Morning everyone, this is Dr. Beecher. In my training and my 10 years of clinical experience, I've been fortunate and blessed to work with patients who have special needs. This has ranged from patients with Down syndrome, patients who are hearing impaired, autistic patients, and patients with general mental and physical disabilities. It's a challenging and rewarding and humbling experience all wrapped in one. Unfortunately, many of my colleagues don't feel the same way, so I've realized that my passion for patients with special needs is a rarity, right? Today I'm just coming to you to talk about how to make your experience for your autistic child a much friendlier one at the dental office, right? In highlighting Autism Awareness Month. Okay, so first things first, the home care is essential because in general for patients, going to the dentist is a very, very scary thing, right? So for your autistic child, you want to make sure that the home care is great. There's brushing, there's flossing. You want to choose toothbrushes with little cartoons that they may like, a toothbrush in their favorite color. Some of them may light up. If they can tolerate a spin brush, you can try them with a spin brush, and that would be great because that mimics our toothbrush at the dental office. So that would automatically, kind of desensitize them to that noise and that feel. Also, you want to help them to floss, and these things are important because it will reduce the complexity of the dental treatment they would have to undergo at the office. So that's the first thing. The second thing is that we can do a look-see visit, or more technically it's called a desensitization visit. So at that visit, your child wouldn't undergo any treatment, and what you can do is if you have other children, you can bring another sibling for a cleaning, or you can do a cleaning and let the patient watch and see what's going on and know that, okay, well, this is what's happening, it's going to be okay for me. So at the desensitization visit, we would introduce them to potentially scary things. So the dental chair is very scary. It moves, it makes a noise. The lights can be scary because a lot of autistic kids are hyperstimulated, right? Their senses are hyperstimulated. So noises, lights, that kind of stuff, it can, make them very anxious. So we can introduce them to all of that, see what they're comfortable with. And it's a very, very good opportunity for us to assess whether they'll be able to undergo treatment in the traditional dental office, or if we have to refer them for specialist intervention and possibly sedation, right? Because if the autism is severe enough, then a specialist would definitely have to deal with those patients. Right. So at the treatment visit, the parent or the primary caregiver would be essential in providing us with information like, what we can do to help the child feel more comfortable. So if it is that they need to bring along their favorite toy, or if it is that they don't like the noise, then you can bring along their favorite songs on the phone, the tablet, whatever, with headphones, of course. Then they can listen to that during treatment, right? If it is that they like certain colors, they like certain flavors of toothpaste, then you can let us know and we can try and accommodate that as well. So of course, it's a lot more complicated than I'm making it out to be, right? But at the end of the day, the keys are the home preparation or proper assessment of the patient during that desensitization visit. And at the end of it, patience. Patience on the part of the dental team, obviously, but also patience on the part of the parent to know that even if we're just able to accomplish an examination and we're not able to accomplish a cleaning, that's still a victory. And then we just try and build on that at each visit to help the patient get more and more accustomed to having their dental care done. Okay, have a good day. Stay safe.